And welcome back to the Morning Blend. So type 2 diabetes is on the rise. There's a lot of contributing factors, and our next guest will show us what's led to the rise. But with his help, it can be treated and managed.
That's right, and here to help is Dr. Paul Tomasic. He is the Medical Director for Well Health, Endocrinology, and Primary Care. It's great having you.
Thank you.
Endocrinologist, first of all, what is an endocrinologist?
Well, an endocrinologist is a specialty physician in the field of endocrinology, which is the study of hormonal disorders.
Aha.
And those hormonal disorders are a great variety of them. Hormones are chemical substances normally made by the body that act at another site traveling through the bloodstream. Hormonal disorders can be too much of a hormone or too little of a hormone.
Right.
And there's a great variety of conditions that we treat.
Wow.
Right. And so we're here to talk about diabetes specifically and why type 2 is on the rise. How does endocrinology step in and affect the diabetes world? Like, how do the two meet?
Well, within the field of endocrinology, type 2 diabetes is really the #1 thing that we see as adult endocrinologists. And type 2 diabetes is definitely on the rise. And it is something that is closely tied in with the growth rates in obesity as well. So there are genetic factors, certainly, but the environment that we live in and how things have developed over the last several decades have really contributed to the growth in diabetes, especially lifestyle and diet.
And you have an example here, exactly how our lifestyle and diet has gone straight to hell. So let's take a look. I mean, what are we looking at here, and what does it mean for us?
Well, what I wanted to show, and I know these are dramatic examples, but looking at the soda example, if you were to go and have a soda in the 1950s, 6.5 ounces was actually a very common size, the smaller size.
Yes.
Wow.
And that's probably less than 300 calories there, even with the amount of sugar that's in that size soda. But if people go and have a 32-ounce soda, now
which is small for some people.
Now you're looking at, in just one serving, the sugar cubes illustrate 90 grams of sugar.
So that is in this?
In a 32-ounce soda.
No
Absolutely.
Wow.
And if you have more than one of those, you're really racking up the calories. And that's the lifestyle that some people lead. And without even realizing it, really contributing to their risk.
Wow.
And the same thing with chocolate, correct?
Another example is just to have a 2 or 3 ounce chocolate is probably under 300 calories, but a 7 to 8 ounce chocolate bar, you're already racking up 1,000 calories.
Right.
And then with popcorn, this is 3 cups is a smaller portion. Those 3 cups, you know, you're looking at also 200 or 300 calories. But if you go to a theater and you get the large popcorn and it's 21 cups and you add the butter, 1,700 calories, you're looking at your total caloric intake
for the day.
In popcorn. So people don't even
it's bottomless.
So people really don't realize, even with these dramatic examples, what risk we've put ourselves in society to developing type 2 diabetes, closely related to that rate of obesity.
For a second, can we talk about the difference in type 1 and type 2 diabetes so people aren't confused?
So type 2 diabetes is what we've been talking about primarily. Type 2 diabetes is a condition where insulin is made, but it's not in the quantity needed to be effective, or it may not be effective at the target cell level because of insulin resistance, closely tied to obesity. Whereas type 1 diabetes is absolute insulin deficiency. And that is the type of diabetes most commonly seen in children, but can be diagnosed in adults. And it really is a different disease in that its absolute insulin deficiency has to be treated with insulin to control blood sugar.
Okay, so one is kind of from birth, the other one is definitely something that's more your surroundings.
The environment, as well as genetic factors, especially in type 2 diabetes, the environment, absolutely.
And they can both be managed?
Absolutely, and that's where an endocrinologist comes in, particularly in type 1 diabetes when insulin deficiency is the disorder. We are the specialists in adults, in my particular case, that help patients treat themselves with insulin and treat with the appropriate amount. Now, there's also pediatric endocrinologists who treat children in a similar manner. As far as type 2 diabetes, the treatment options really focusing on diet and exercise first, seeing a dietitian, attending a diabetes class.
That could stop you from having to go on to the medication.
It could even stop you from even having diabetes in the first place if you're pre-diabetic. And there's some excellent pre-diabetic programs that people can participate in as well. But if you get to a point where diet and exercise are not enough, then that's where medications come into play. Type 2 diabetes can often be treated with oral medications or pills, many of them only once or twice a day. If a patient gets to a point where they really need injectable medications to control their blood sugar, an endocrinologist is often needed.
We got about 10 seconds left. How does somebody make an appointment with their endocrinologist?
Well, it's by referral through their primary care practitioner, usually. But if their plan allows it, they can look up an endocrinologist listing in their health plan. In my particular company, wellhealthendocrinology.com is the website to learn more about my practice.
There you go.
It's great having
the
you,
whole
Paul.
world's fallen in love with you now. You're so smart.
Thank you so much.
Thank you,
All
Doctor.
right, thank you.
Take that away from me.
There you go.
Thank you very
Don't
much.
sip that.
Type 2 diabetes is on the rise, as you've seen this morning. If you have any questions, you can contact Well Health Endocrinology. Their information is right there on your screen. They're also on Facebook and Twitter. And do you know